Well, today on the show, we're over in Pascagoula at the new offices of the AB Advocate Group. Now, you may remember we had Miss Ann Cho over at the station here last year,
right.
But now we've come to your brand new offices. You're the CEO here. How are you? It's good to see you again.
Oh, great to see you. I'm doing great.
Well, your offices are beautiful.
Well, thank you very much.
Nice and roomy, and you've got some great staff that I got to meet before we came back here. If you would start off, Ann, and tell us a little bit of background about yourself.
Well, I'm a native of Mobile, Alabama. We ended up raising our children in Biloxi, Mississippi, and we've traveled a lot throughout the country with my husband's work. I have over 30 years experience in nursing. I got my bachelor's at USA Medical Center, and I got my master's in nursing administration at Southern Miss. I have worked as everything from a CNA all the way up to a chief nursing officer in hospitals, nursing homes, rehab centers. I've been a nurse consultant traveling the country, and I've also had the pleasure of being a nursing professor.
So you know a lot about helping people.
Oh, absolutely. That's what nursing is all about, and that's what advocates are for.
Well, I know some great nurses as well. Tell us about AB Advocate Group and how this got started.
Well, this got started when actually I came home for a family reunion in 2016, and my brother is a quadriplegic, and he needed a patient advocate to help him navigate the healthcare system because he had like 3 insurances, very complex case. And it was decided that there were a lot of people that needed that help, and I know we had done it in California and New York, and decided to come back home and open up a office here.
So what are some of the things that the AB Advocate Group does?
Our biggest clientele are people who are looking to apply for disability, whether it's Social Security or the veterans or even private disability. We have several clients right now for that. And basically what we do is we work for the client. We don't work for the insurance company. They have a lot of advocates. We don't work for the hospitals. We don't work for any providers, but we work for the clients.
So the client comes to you, you do, I guess, an evaluation, an interview, and see exactly what they need before you recommend to them or look for them some insurance or supplements or whatever, what they need?
Right. They come to us and we give them a free consultation because some people we can't help. There's really nothing we can do. And we let them know the information and how we can help them. Basically what we do is we give them the information so they can make an informed decision and take a part of their health care, which is really what Medicare, Medicaid is trying to get the country to go towards. Let people make their own decisions. Because
there's a lot of choices out there.
There is a lot of choices. And these small choices will lead up to big choices. So there's everything.
Well, I was looking at one of your flyers here was the information on there, and it says, "Can anyone help me find answers? Diagnosis, surgery, treatments, providers, changing doctors, as you mentioned, disability, hospice, right to die."
Yes, the right to die is basically what hospice does, and what they do is people don't, let's say you have cancer, and there are those that don't want to go through the treatment because the treatment's pretty rough.
Right.
And we step in and we help them navigate, find the right hospice to help them, and allow
And there's a lot
people,
of great hospices along the Gulf Coast.
Right, and we have a lot of hospices we refer our clients to, let them pick the hospice they want, and then we help them. But they don't just have hospice, they have multiple services, again.
Medicare, insurance, COBRA, which is something that, I guess with COBRA, that's kind of that insurance that you have to get when you're in between situations, like you leaving a job, but you haven't quite got to the age for Medicare.
Right.
So you've got to have something, well, you don't have to, but you need to have something to protect yourself.
Let me give you an example. I had a client who worked at Ingalls. He became ill. He had to take family medical leave. Then he had to switch to COBRA. Then he had to go to private insurance. Then he went to Medicare, and then he went to his VA benefits. It is a very complex process, and we had to help him guide through all of those steps so he was insured all the way through.
Wow.
And we did that in 2 months, no, 3 months for this gentleman.
Really? And I guess that's one of the things that, as you mentioned, that you're here to help them. You know, you're like you're a trail guide, you know, on a hunt.
Exactly.
You're guiding them. You're guiding them to the different where they need to go to, you know, to be helped.
To be helped, and we also go into the court system.
Really?
Yes, I've helped juveniles who had mental health issues and assisted them in getting the care they needed so they could perform in school, etc. I've helped veterans who have been injured. Mostly it's mental health that I help people with who find themselves in the court system.
What are 5 Wishes?
5 Wishes is a national program, and what it is, I recommend everyone fill one out. And it is a complete package of your wishes before you die. And simple things like, I would love for this hymn to be played in my room if I'm dying, or I want my family to remember this about me. And it also gives you your living will, your everything that you want when you become critically ill or you're at the end of your life.
Which is important. A lot of people don't think about that. I mean, whenever you're, you know, at that point in your life where you know the end is soon, you want it done your way. You don't want your family fighting, well, I want it done this way, I want it done that way. You know, this is what I want. This is what I want done. If I want Garth Brooks the dance played at my memorial, then that's I'm gonna put it on there.
And it's important for people because Alzheimer's is up, dementia is up. It's important you do it before you reach that stage.
Now, I guess if they want some more information about this, of course, numbers on the screen, website, and everything. You're located over here on Ingalls Avenue, 1420 Ingalls Avenue in Pascagoula.
Yes, sir.
Just west of Market Street. You're easy to find. But I guess they can make an appointment with you and come in and get an evaluation or just an interview.
Yes, they get a free consultation. We have multiple patient advocates that will assist you. Some specialize in different areas. And we would be glad to let you know if we can help you.
That's awesome. And it's good to see you again. Your place is wonderful.
Thank you so
really
much.
Is. Again, if you or a loved one are in that stage of your life where you need some help or you're going to need some help making some decisions, you need the folks here at AB Advocate in Pascagoula.